Morning, everyone, and welcome. And this morning we have the privilege of being joined by Vice Admiral Vivek H. Murthy, the 21st Surgeon General of the United States, for a conversation on the importance of human community in the moment. And Dr. Murthy, it is an honor to have you join us. Dr. Murthy is serving as our Surgeon General, having served his first term from 2014 to 2017, having been nominated then by President Barack Obama, began a second term last spring after being nominated to the role by President Joe Biden. As Surgeon General, a position many refer to as the nation's doctor, Dr. Murthy is a commissioned officer of the United States Public Health Service, where as Vice Admiral, he oversees over 6,000 fellow officers in more than 800 locations around the world. In his role, he has responded to a number of urgent public health challenges, including the outbreaks of Zika and Ebola between 2014 and 2016, the opioid epidemic, and the threat of addictions, such as tobacco and the use of e-cigarettes. Over his long and distinguished career, he has made many contributions to public health. With his work on the Swathia Project, which provides community-based health training and education to women in rural India, with Doctors for America, which he co-founded to help cultivate physician collaboration, patient dialogue, and greater advocacy for public health policy, and through the organization he co-founded, Visions, focused on HIV/AIDS peer-to-peer education. It's been an honor for me to serve alongside him previously as a member of the Board of Governors of the NCAA, where he's helped to support our young people engaged in intercollegiate athletics. In 2020, Dr. Murthy was named the recipient of the Vilsack Gold Award for Humanism in Healthcare, an award that honors the extraordinary contributions of immigrants to the field of public health and healthcare. Dr. Murthy was recognized specifically, and I quote, for his multifaceted approach to addressing the opioid crisis and his continued advocacy and support of human and community-centered care. More recently, he's been fully engaged in his role as the nation's doctor, serving as a leading voice in the challenge of responding to COVID-19. This past December, Dr. Murthy released a Surgeon General's Advisory, an action reserved for only the most pressing and significant public health issues, entitled Protecting Your Mental Health. The report lays out recommendations for families and caregivers and educators and institutions to enhance the positive and supporting role they play in the formation of children, adolescents, and young adults. It also provides actions that young people can take on their own to support themselves and their own well-being, including both asking for help and serving as a source of help for those in need. In the report, he wrote, and I quote, coming out of the COVID-19 pandemic, we have an unprecedented opportunity as a country to rebuild in a way that refocuses our identity and common values, puts people first, and strengthens our connections to each other, close quote. So I wish to again thank him for being with us today, and it's now my privilege to introduce Vice Admiral Dr. Vivek H. Murthy, the 21st Surgeon General of the United States.
Well, thank you so much, President DeGioia, for that very kind introduction. And I also just want to thank all of the staff and membership and leadership of ACCU for welcoming me here today. It's, I know, a surreal moment in a sense for our country, for many of us, as we look at everything that's happened the last 2 years in this pandemic, and yet still find ourselves moving forward, but still mired, in a very difficult time. But throughout all of this, you have had incredibly challenging and difficult jobs. You've had to be on the front lines to help students and their families and staff navigate this difficult moment. Often when we didn't know, especially in the early days, enough about the virus to understand how it was spreading, how dangerous it was, how best to protect ourselves. It was you who had to make these difficult decisions for your communities and help reassure them and see them through. So I just want to acknowledge that because being on the front lines is not easy. And I know we are still not, completely through this pandemic, even though we are, I believe, in a better place with more tools than we were before. So I just, at the outset, want to offer and extend my gratitude to you for caring for young people throughout our country during this extremely difficult time and helping them get back on a path to not only education, but to community, which is what universities help provide. And that's especially important in a moment like this.
Well, thank you very much. And perhaps we can build from that. Um, is there anything more you'd like to share with us about the present moment in the pandemic? What kind of
Yeah.
perspective can you offer us from your position as Surgeon General? The pandemic's overall trajectory now in our second year.
Well, there's a lot to say, but I would summarize it in the following way. We have certainly come a long way in the last 2 years. We are not where we were in March of 2020 in terms of our knowledge, our tools, or our clarity on how we get through this pandemic. I do want to say from the outset that this pandemic will end. We will come to a place where we can go about our lives more normally without the restrictions that we have right now. And I do think that time will come. While I can't pinpoint an exact date, I'll tell you why I feel optimistic that it will come. I think it'll come because our ultimate goal here is to be able to knock down the severity of this virus to the point where we can deal with it like any other respiratory virus, like the flu or the cold. But in order to do that, we really need two critical tools. One are vaccines, and the others are medications or therapeutics that we can use, the latter of which you can use when someone gets sick to reduce the likelihood they end up in the hospital or, God forbid, lose their life. And the good news is that we have now vaccines that work and work well that are readily available in all corners of our country. We also, in terms of therapeutics, we have more medications, both oral and intravenous medications, collectively now than we've had at any other point during the pandemic. We still need to ramp up our supply even further, and every month that comes from here on outward, we will have more of that supply. Those are two very powerful tools uh, that we can use, and I would actually also underscore that the tools we have for COVID now, when it comes to vaccines and therapeutics, are actually better than the tools we have for the flu. These vaccines work even better than what we've traditionally seen with the flu vaccine. The therapeutics are more in number and more effective as well. So these are good signs. The other things, what that'll enable us to do then is to strategically operate in the future where we utilize things like masks and testing strategically when we need it, when there's a threat of a new wave that may come, or if someone is more vulnerable, if they're immunocompromised or at higher risk, they can utilize those tools also and scale up and down based on their need. But that time, even though it's not immediate, when we can transition to, as I think of it, that equilibrium phase, because then it's not immediate because we still have hundreds of thousands of cases per day, more than 2,000 people dying each day, and around 130,000 people hospitalized in our country right now with COVID. So we still have too much spread, but those numbers are improving in much of the country. They are coming down, and so I'm optimistic that we will get there. But the last thing I'll say on this, and I'm happy to answer any more questions in our Q&A on COVID, is that there are costs of this pandemic, as all of you know better than anyone else, costs that go beyond what we see in the numbers of cases, hospitalizations, and deaths. And those consequences go to the mental health and well-being of young people and older people across our country as they've struggled with the uncertainty, with loss of family and friends. The cost also goes to the disruption in our lives, and especially the lives of children and young adults who have looked at the future and recognized that it's more uncertain than ever for them, or has been at least over the last 2 years, as they wonder when the pandemic will end, how it will impact their education, and how it will impact their job prospects afterward, as well as their social ties. So that cost, the mental health costs of the pandemic, the broader cost to our well-being, that is something that we will have to grapple with, not just now, but after the pandemic is over. It's a challenge, President DeGioia, that we've seen and with other natural disasters. After a hurricane, after a tornado comes through a community, there's the rebuilding that happens, but long after the last house is rebuilt, there are the mental health impacts and the trauma of that disaster that we have to contend with. And COVID has, in a sense, inflicted a trauma upon many people from a mental health perspective, and that's something we'll have to be mindful of and responsive to as we come through this pandemic and rebuild in the months ahead.
In recent years, you've shared some powerful ideas on the importance of human connection, the hidden impact of loneliness on our health, the social power of community. Can you tell us how you first came to be interested in these subjects?
Absolutely. Well, I've come to realize, President DeGioia, and I'm having a hard time not calling you Jack because we're friends, and but I will get this right.
Jack's okay.
Um,
It's okay.
yeah. Well, then please call me Vivek as well, because we've known each other for a bit here. Um, Jack, I think when I started my job as Surgeon General in 2014, and if you had just told me I'd be thinking about working on talking about the power of human connection and community, I would have perhaps been skeptical. Um, but what happened to me is that I began my tenure as Surgeon General with a listening tour, talking to people around the country and asking really just a simple question, which is, how can I help? And I tried to just shut up and listen, for lack of a better word. And I'll tell you what I heard was incredibly enriching. I heard some things that I expected to hear. People who were concerned about the challenge of addiction in their communities, who were worried about rates of childhood obesity, who saw the rise of e-cigarettes among youth and wondered if that was harming our children. But what I didn't expect to hear as much were these stories of isolation and loneliness that people spoke of. They often would say, I feel like I've got all these burdens in my life and I have to carry them by myself. Or I feel that if I disappeared tomorrow, no one would even notice. Or I feel invisible. And I was hearing that not only from people who were in the twilight years of their life and who were living alone, but I was hearing that from college students on college campuses who were surrounded by hundreds, if not thousands, of other students. I was hearing it from parents who were surrounded by people all day long in their busy lives, but yet felt somehow that they were on their own. I was hearing it from members of Congress, honestly, who were absolutely surrounded by people all the time, but would tell me quietly in hushed tones behind closed doors that they too and many of their colleagues were struggling with a sense of isolation. So I came to see that this was very common. And what it reminded me of, Jack, were my experiences as a doctor in the hospital, caring for patients over the years and recognizing that even though I learned very little, if anything, about loneliness and isolation in medical school, that many of my patients seemed to be struggling with loneliness, with being not having anyone to support them, especially during their health crises. And finally, there's had a personal sort of tone for me as well, undertone, because as a child, I had struggled a lot with loneliness when I was in elementary school, not because I was antisocial or because I didn't like people. In fact, I love people, and I love to play team sports. I love to hang out with other kids, but I was painfully shy, and making friends was not so easy for me as a result. And so I still remember the scariest time of my day was lunchtime every day in elementary school, walking into that cafeteria, not knowing if there would be somebody to sit next to. And at the time, I thought I was the only one struggling like that. But since then, I've come to realize how many of our children do, in fact, struggle with a sense of loneliness and isolation. There are more people in our country, Jack, who are struggling with loneliness than actually are diagnosed with diabetes when it comes to adults with loneliness versus adults with diabetes. The other thing that's important to know is that loneliness is not just a bad feeling; it's also consequential for our health. The people who struggle with loneliness are at increased risk for anxiety, for depression, but also for heart disease, for dementia, for premature death. And the list goes on in terms of health consequences. And it has to do with the fact that loneliness induces a stress state in our body. And stress states acutely in the short term can be helpful. They can prompt action. They can spur us to do something we may not otherwise have done. But when they're chronic, when they last for a long time, they tend to lead to inflammation and damage in our body. So I came to understand over time, Jack, that this loneliness was extraordinarily consequential and common. And finally, if we think even about COVID, about the context that we're in right now, what was particularly damaging about COVID is that it separated people from each other, especially in a moment when they needed one another, when they needed support. Because when we often encounter hard times, many of us we'll pick up the phone and call someone we love, or we'll go get in the car and go visit someone who cares about us, because it is helpful to be with others during stressful times and during joyful times. COVID made that harder for people, which is why it was particularly damaging. When I think about all of this, you pull it all together from a public health perspective, Jack, I've realized one thing, which is that in moments of crisis, whether it's a public health crisis or another crisis, one of your most powerful tools to deal with that crisis is community. You cannot, execute solutions and the best laid strategic plans if you don't have a community that cares about one another and where people trust one another. I know many of you who are listening here today are leading universities and have had our experience in building community. You're experts in that. It's what you know that is so essential in any environment, whether it's a university, a business, or a grade school. You got to build community, but it's important in a country as well. And I worry that in our country right now, that as people have become more isolated, as many of the forces that created community, from faith organizations to YMCAs to other sort of community institutions, as participation in those institutions has diminished over time, we have had a weaker sense of community. We have less social capital, in a sense, than we've had before. And that is hurting us in terms of our health, in terms of our ability to respond to emergencies and our overall well being.
What are some of the things we could be doing as institutions of higher learning to address the kinds of challenges that you've just shared with us?
Hmm. Well, I think there's several things I think that you can play an incredibly important role in, and I suspect some of you are doing this already. I think number one, recognizing just how common loneliness and isolation are is very important, and being able to start conversations and dialogues in communities about how we build community, about how we foster social connection is also important. There are a lot of parallels here to the struggles we've had with substance use disorders, where we saw that the stigma around addiction was a big part of what kept people from coming forward and asking for help. And we see that also when it comes to issues related to social isolation. Many of the college students I've spoken to over the years often say, yes, they would love to get together and get to know and befriend other students, but they often feel that they're living in an extroverted world where the way to do that is to go to parties. And often introverts don't like to go to large parties. I say that as a card-carrying introvert myself, who for whom that was not always the easiest strategy, to make friends when I was in college. But I think number one, acknowledging the challenge. Number two, starting dialogues about how to foster social connection. Number three, having different pathways through which people can meet one another and connect. There's a when I in the past, when I was used to write on the subject of community and connection, I remember writing about a student at the a student at the University of Pennsylvania who was an introvert by nature, had a really tough time during her freshman year, but ended up actually on her own, actually, and then eventually with support from the university, um, gathering students on her own who had felt left out to actually on once a week just talk about subjects that they were concerned about or that they cared about. And they would gather, I believe it was like on a Friday evening in a place that she had found on campus. And it was one of these moments where a little bit of structure, a little bit of intention brought to a gathering went a long way to creating a forum where people felt that they could be themselves. And that's really the challenge of today. It's really a challenge that not only young people, but older people face, which is, are there places where people can truly show up as themselves without fearing judgment, without worrying that they're somehow going to be cast aside if they don't fit in, if they hold disparate views? And creating those spaces on campus is extremely important. The last thing I would offer is this. There's an old saying that we were often taught in when I was in medical training, which is that if you don't measure it, it doesn't matter. That's perhaps, as many old sayings are, a bit of a too black and white of a statement. But the heart of it is true, which is that, and I would modify it to say, if we don't measure it, we often don't understand it, right? So when we don't measure things like social connection and loneliness on our campuses or in our businesses, we don't understand the extent to which it may exist or how consequential it may be. And the good news is that there are many tools, validated tools that allow us to now measure people's sense of social cohesion, over time. But I think measuring that actually matters, and tracking that the way we would track academics or graduation rates, I think is as important to the overall health and well-being of a community as perhaps any other measure I can imagine.
Thank you. Thank you. If we could go just a little bit deeper, you differentiate between loneliness and social isolation. Can you take us a little, give us a little bit more perspective on this important distinction that you make in the work that you're engaged in?
Absolutely. And loneliness is a subjective feeling. It's the feeling that the social connections we need in our life are greater than the social connections we have. And in that gap, we experience loneliness. Isolation, on the other hand, is an objective term. It's an objective description of the number of connections we have around us. So we might say, for example, that um, my father's, generation that grew up in a small village in India with very few connections to the outside world and often in isolated, in rural areas far apart from other people, that they were isolated geographically. It turns out, though, those same individuals, even though they were in rural areas where the population density was very low and didn't see other folks very often, they were isolated, but they were not lonely, because even a few connections that they had, those were high quality connections. They trusted one another, depended on one another, and so they felt they had what they needed. The flip is true, though. Also, we can have people who are surrounded by people by others constantly, as people are often in big cities or on college campuses. But if they don't feel that they have sufficient high quality relationships where they can show up as themselves, or they can be themselves around others, then they can often feel lonely. The reason this is so important for college campuses in particular is that more than 60% of college students report that they've felt very lonely within the past year. And if you look even just in the last 2 weeks, it's about 30% of college students who say just even in the last 2 weeks, they've struggled with loneliness. Now, it's not to say that people throughout their life won't experience bouts of loneliness here and there, but and that's normal. And that's really important for us to also convey to young people, because in the same way we experience hunger or thirst when our body is trying to tell us that we need something, like food or water, uh, because we naturally need human connection. When we don't have it, our body sends us a similar signal in the form of loneliness. And if we respond to that signal by seeking out genuine, authentic human connection, then we may be fine. It's when that loneliness stretches for long periods of time. It's when we don't know how to deal with it and find connection. It's when it starts to impact our self-esteem, our sense of worth. That is when it becomes damaging. And I want to underscore that, because right now, one of the things I worry about a great deal for my children, as well as for young people everywhere, is that there are so many messages, Jack, that our kids receive that often tell them that they are not good enough. Right? You look at the advertisements and messages that young people are bombarded with these days, whether it's through traditional media or social media, and it's often messages that are telling them that they're not good looking enough, they're not smart enough, they're not rich enough, they're not famous enough, they don't have enough followers, on social media, whatever it might be. Um, these are the messages young people are receiving. And loneliness compounds that, because loneliness, when experienced over time, can make people feel that they're alone because they're not worthy, because somehow they aren't, interesting enough or attractive enough. And over time, that can be quite damaging and can become actually a self-fulfilling prophecy in a downward spiral. So this is a challenge we see in loneliness, which is the lonelier people get, the harder it becomes for them to interact with other people, because they don't believe that other people would want to actually connect with them anymore. And then what you have to do is break out of that downward spiral in some way. And two things that can really help break out of that outward spiral are: number one, when other people intervene, when they come and they reach out to you and they bring you in. And that's why, like, those the seemingly small things that we may do, asking a coworker to have coffee, inviting a student to office hours just to talk, to understand how they're doing, pausing just to check in on someone at the end of the day as you're leaving the office to see how they are. These seem like small things, but they make a big difference, because they tell someone, you matter, I see you, you're not invisible. The other thing that can help break out of that cycle of loneliness is actually service. And this is a underappreciated but incredibly powerful tool to foster social connection, because acts of service, whether that's volunteering in a soup kitchen or Habitat for Humanity, or whether that's simply offering to help someone who is in need around us in a moment. Those acts of service are powerful because they not only connect us to someone else in the moment, but they remind us that we have value to bring to the world, which is something that we so often forget when we struggle with loneliness. So that's how I would think about the difference between loneliness and isolation. Loneliness is a subjective feeling, something many of our young people experience. And remember, you just cannot tell from the outside who is struggling with loneliness because we tell people that they have to put on the brave face. We tell them that they have to look like they're extroverted, they're having a great time, especially on social media. We tell them that they have to curate their lives before they share them with others. But so often, people who look like they're having a wonderful time online are really struggling inside.
Sure. What about groups? What about groups that struggle to connect with one another? How do we break down divisions that are serving as blocks to human connection?
Well, that is certainly a challenge now for us in our society more broadly, and it's painful to see. You know, my parents, Jack, like generations of immigrants, came to the United States because they felt that this was a place where their children, my sister and I, would not be judged by our faith, the color of our skin, you know, the fact that we had funny sounding names, but that we'd be judged by our desire to be part of a community, our ideas, by our willingness to work hard, and you know, in many ways, we have been blessed to experience much of that, you know, in our home in the United States of America, but what worries me is that we have many divisions that have grown in some ways, you know, on their own, in some ways been fostered over time, but divisions that I think threaten our overall health and well-being. So to build, I think, greater connection, we have to, between groups, we have to actually come to know one another. And society has become very siloed and fragmented, in some ways aided and abetted by technology. You can online now find groups that coincide exactly with how you think, with your life experience, and choose only to interact with those groups and with no others. One of the things I think that's powerful about universities is that they can bring people together from many different walks of life and backgrounds and give them the opportunity to learn about one another, to interact. It's also one of the things I think that's powerful about military service. It brings people together from around the country to have an intense experience together and to often learn about one another. But I don't think two things. One, I don't think that we have enough ways for people to actually do that. I do think the opportunity to serve your country, not necessarily only in uniform, but also outside of uniform, to engage in the act of public service in communities across the country, whether that's through experiences like Teach for America or the Peace Corps or others. These are very important opportunities, and I think we need more of them in the country. I also think, though, that just putting people of different backgrounds in one place doesn't guarantee that they get to know one another. And this is where I think that having structured, lightly structured opportunities for people of different backgrounds to come together and to get to listen to one another and understand one another is actually very important. It's where I think, for example, sports are so important as well. And Jack, when you and I were working together on on collegiate athletics, one of the reasons I was honored and excited to be a part of that endeavor was because I think sports is a place where people of different backgrounds can come together, can bond around a shared endeavor, but then also come to learn about one another. So we need more experiences like that bring people together across different backgrounds and different groups and help prioritize the collective solely over the concerns of the individual. I'll lastly say this, Jack. You know, one of the things, I'm a person of faith. My faith is very important to me. And one of the things I've come to appreciate, uh, over the years about many of our faith traditions, is they're often rooted in the idea that our well-being is tied to the well-being of others. That we have a obligation to care for those around us, not just our family, but our neighbors, those who may not have the resources we have, those who may be in a difficult spot and who are struggling. It is we have a responsibility to care for one another, and we are stronger when we do so. And that ethos, I worry, has weakened. In our present day, we have a pendulum that has swung so far toward the individual, and so far away from the collective and community and family, that we are in a place where, when faced with threats, that we splinter instead of coming together, which is what we need to do. And I think rebuilding that sense of community is as much about the opportunities that we create for people to get to know one another as I think the narratives that we build through everything from entertainment, through the words we speak, through how we raise kids, the narrative that tells our young people and older people that the collective matters too, and that our contributions to each other's lives is just as important as the contributions we make in our own life, or the accolades or the wealth that we may accumulate in our own life. I'll just say this, Jack. I think about the people I've met over their life who have been truly successful, and by successful I don't mean who have become wealthy or powerful. I mean who have managed to experience great love in their life, love for family, love for friends, love for community. Um, what they often talk about it's brought them greatest fulfillment is not like the size of their bank account. It's the bonds that they were able to build. It's the love they were able to give and receive. And our faith tradition speaks so clearly, so in unison about the power of love, about how that is foundational to building community. But yet, I think about how we talk about love and community, and we often do as so in modern society in a way that somehow implies that they're soft, or that they're not powerful, or that, gosh, if you're someone talking about love and community, that's weakness. Like, think about who we hold up as examples of success in media and in movies and in entertainment. We talk about the individual who built the company, the individual who you put a sports team on his or her back and led them to victory. We don't talk often enough about the collective, about the power of love to lift us up and lift other people up, and to take us to places that we couldn't have gone before. Like, we didn't put a man on the moon because of one person. We did that because and as a collective, put our minds and our hearts behind a vision of what could be. And we supported one another and made that happen. So this, I think, is the great challenge of our time, Jack, more so than even academic scores or economic indicators. It is, do we have the will and the heart to build and foster community and connection? Because that is the foundation on which we build everything else.
Thank you. Thank you. We're going to open it up to questions. We've turned the microphone so they'll be looking straight at you. Anybody who would like to ask a question, if you could sort of come up here in the front row, and I'll call on each of you. And while we're waiting for folks to come to the microphone, could you just share a little bit about the public health service? When I introduced you, I mentioned the role that you play with our public health service. Could you just share with our colleagues a little bit about the public health service while we wait for our first question?
Absolutely. Thank you for asking. This is actually one of the services that's lesser known to the public, but the Surgeon General oversees one of the 8 uniformed services in the US government, and that is the United States Public Health Service. It's 6,000 nurses, doctors, physical therapists, pharmacists, and other health professionals who work to advance the public health of the nation each day in various agencies across the country. But we also deploy them during times of emergency to help stand up and shore up healthcare systems, provide direct care. We sent hundreds of officers to Monrovia in Liberia during the Ebola outbreak there to set up something called the Monrovia Medical Unit. When there are hurricanes or tornadoes, we send officers all across the country to help during COVID-19. We also have sent thousands of officers around the country to set up testing units to help administer vaccines and to strengthen public health departments and local hospital systems.
Thank you. Thank you. So we have our first question. Please introduce yourself and ask the Surgeon General your question.
Dr. Murthy, thank you very much for being with us. I'm Mike Pressimone from Notre Dame College of Ohio. Apropos, perhaps, your comments about community, I think many of us believe that racism is a public health crisis in the country. What are your thoughts about the role of the Surgeon General in helping to kind of elevate that as a conversation that we need to have in this country? Thank you.
Well, thank you so much for that question. And I couldn't agree with you more that racism is a threat on so many levels, but it's a threat to community. It's a threat to connection. I mentioned earlier when I was talking about loneliness that what is so painful and so destructive about loneliness is it sends people a message that they don't matter. And racism is the same way. Racism tells people that they inherently don't matter because of the color of their skin, because of their racial and ethnic background. That is extraordinarily destructive, not only to the individual, but it actually hurts all of us. We are the United States of America society. It's predicated on the notion that people of different backgrounds can come together and do extraordinary things, things that they couldn't do on their own. Again, it's what brought my parents and many other families of immigrants to this country. But even though we have made progress in living up to that promise, we have not fulfilled that entirely. And we still are struggling with the scourge of racism. We see it in healthcare as well, where communities of color have often had disparate access to healthcare, to prevention, and then they struggle with higher rates of illness and disease. We've seen that with COVID-19, where the communities of color have been harder hit by the virus in terms of hospitalizations and deaths. So I absolutely see the issue of racism as a core issue in public health, as one of the issues that I certainly talk about, will continue to talk about and lift up, because we've got to recognize the damage it does, not just to communities of color, but to all of us when we tell people that they matter less simply because of the color of their skin. And we've got to build institutions and practices and a culture that supports the kind of equity we're talking about. And that includes tracking it. One of the things that happens when you track how equitably you're providing services and delivering outcomes is that you have accountability. Just take the vaccination effort for COVID-19, because we were aggressively tracking equity measures that helped us recognize how big the gap was and aggressively move toward closing that gap. So we now, if you look at the adult population, have finally now similar proportions of Black, Latino, and white adults who are vaccinated because of aggressive efforts around equity. But it doesn't happen if you're not willing to talk about it, to look at it, to measure it, and to hold yourself accountable. And that's what we've got to do as institutions.
Thank you again for your remarks. Brother Tom Giardino from the Association of Marianist Universities. One of the things that we experience in the college interchange is the role of parents, often millennials. And we have all kinds of metaphors that keep changing, but basically micromanaging parents. I'm wondering if you could talk a little bit about what you see as that dynamic of parents who are so over-responsible, perhaps, and students being under-responsible in terms of building up resilience or community, as you've been speaking about. Thank you.
Well, thank you, Father, for that question. I think it's interesting you mentioned this. I was actually just speaking a few days ago with a group of developmental psychologists and sociologists about this very issue of how do we raise young people, give them support, but also allow them to encounter adversity from time to time, which is a natural part of how we grow stronger, as we grow up. I think that this is certainly not an easy balance to strike, but I think for many kids, and I would say to some extent for families as well, it's easier for them to engage with adversity if they know that they have a network of supportive relationships to fall back on. Not every child is blessed to have that, but it is where I think universities have such a powerful role that they play, because as all of you know better than anyone, universities often can become surrogate family. They can become that support that children may not have had earlier in life, and that makes it easier to take on adversity, to be challenged. But I do think adversity is important. It's just a part of, look, when you go to the gym, you challenge your muscles with adversity, and then in the form of a weight that you're lifting or time on a treadmill where you have to exert yourself, and that makes you stronger over time. Similar is true, like with our mental and psychological strength as well, that when we have to work through challenges, it can make us stronger. There's a limit to that, though, which is that there are some challenges that are so extreme that without the right support, without the right care, it can lead to more damage. I'll tell you, during COVID, for example, more than 140,000 children have lost a caregiver. That's an incredibly traumatic experience. Is it possible that that some of those, or I should say rather, it's likely that some of those children will have a hard time, not just now, but for years to come. But if they have the support of a family, of community around them, that can help them not only heal, but emerge with potentially even a stronger and healthier perspective. They may inspire them to be more empathic toward others who have struggled as well. It may enable them to turn their pain and their grief into a source of strength and empathy and connection. But support is required for that. And I often tell parents that as hard as it's been for many of us parents during this pandemic, trying to figure out how to guide our kids, how to be with our kids and do right by our children. One of the most important things a child needs in their life is secure attachments, and more specifically, to know that there are people who love them unconditionally in their life, who will be there for them. That allows children to go out and take risks and to know that they have the most important of all safety nets, which is people who care about them.
Good morning, Dr. Murthy. My name's Patrick Hornbeck from Fordham University in New York, and I want to thank you first for your vulnerability. I too struggled profoundly with loneliness as an undergraduate, and I think it's so important that we name these experiences that so many people have. But I want to ask your advice about a tension that I imagine some of us in this room feel, which is that there are leaders in the faith community represented here who believe that the Catholic tradition requires a different response on a number of issues than the responses that you and other public health experts are giving, whether it comes to being vaccinated against COVID-19 or fully including LGBTQ members of our communities or responding to the victims of sexual harassment and violence. And so I completely agree with you that it's our faith communities that can provide a grounding for so much of the community building that needs to happen. But what advice would you have when authority figures in a faith tradition don't quite see eye to eye with those of us who have a different vision for promoting community?
This is a very good question, and it mirrors, I think, the challenge we have in communities not related to faith, where people will have the best of intentions and shared intentions, but may have different beliefs that may create tensions or difficulties. Look, I think what's most important to do in these circumstances is to recenter ourselves around our common purpose here. And one of the common purposes, I believe, of faith traditions is to help people build and find a community, and through that community to do greater things, whether it's to connect to God, to be of service to others, to serve in other ways, their community at large. And how we build that community, I think, has to involve listening to the people we are seeking to serve. One of the things I learned early on in medical school is I was told by a professor, I always remember, Dr. August Fortin. He said, we interrupt people all the time as doctors. We often interrupt them before 60 seconds has elapsed when they start speaking. He said, if you listen to a patient long enough, they will tell you what they need. And then it is your duty to listen, to not only listen, but to understand and incorporate that into your actions. I think the same is true here. I think that if we can come together around who we are seeking to serve, around what our end goal is, which is to build community and strengthen human connection, then I think we have to listen to the students that we are seeking to serve. And even if they, make choices in their own lives, or come from backgrounds that are different from ours, or if they have beliefs or practices that we may not necessarily agree with, our duty, I believe, is to understand and see their common humanity, the humanity they share with us. I've, as a person of faith, have always believed that every individual has a spark of God within them. And whether I disagree with them or not, whether I can understand all aspects of their background or not, what I do know is that we share that in common, that divine connection. And that means then that I have an obligation to help support them, just as I hope they will help support me during their times of need. So I do believe we have to recenter around that, and that we have to listen carefully to the people we are seeking to serve and help them, even if we have different faiths, backgrounds, and beliefs from them. That's what we've got to do more broadly as a country. I think we have allowed the things that we differ on to have so much attention and emphasis that they have obscured the things we do agree on and have dimmed the source, a powerful source of unity that we do have. And I think faith is a powerful source of community and unity. And I think it's one of the forces we need right now in our country to bring people together and lift all people up.
Dr. Murphy, thank you so much for your comments today. You've shared a lot about the importance of the work of building community, and as we all know, and as you know, it's very tough work. So I'm curious, on the days when you are overwhelmed by the suffering or the division that exists or the sheer work that still lies before us, who or what brings you hope?
Hmm.
My name is
Well, thank you.
Nicole. Yeah, my name is Nicole Labadie from the University of St. Thomas in Houston.
Nicole, thank you for that question. I'll first say there are days where I feel, uh, there are days and moments where I feel saddened and despondent, about the state of things, where I feel just tired and exhausted myself, and I imagine everyone in this group has felt that at some point. When you push against walls, you get tired from time to time. It doesn't mean we stop pushing. Um, but in those moments, like there are a few things that I reach for when I'm looking for hope. One of them is my children. My kids are 4 and 5, and they, like all kids, are their gift is that they can be in the present. They can experience joy in the moment. They can appreciate the simple things in life and recognize that as much as the world may have its large burdens, that laughter and joy are still within our reach if we're willing to open ourselves up to it, to appreciate the small things, and we appreciate the people in our lives. So that's one thing that gives me hope. The other thing that gives me hope is my faith. I turn to my faith often during times of struggle. In those moments, and this is my own personal belief, but I'll share it with you, and it feels appropriate, especially in this setting with all of you. Um, I think, I try to remember my connection with God, and I think it's in moments where I feel sort of disconnected or separate from God that I forget that I'm not alone, and I forget that where my true source of power comes from, and where I believe all of our power comes from, which is our connection to the divine. Um, and so there are things I have to do to remember that connection. Sometimes it's a brief meditation. Sometimes it's a moment that I spend just chanting. Sometimes it's reading a passage from Scripture that reminds me, of that connection I have with God. There's one last thing I do when I'm looking for hope, which is I keep actually a set of videos which are often speeches, some fictional, some real life speeches. But those are speeches that have given me inspiration over the years. And I reach to those when I'm feeling down, and I'll just listen to them, and they'll help lift me up. So we all need something that's in our toolbox that we can reach for during those down moments, because they will come. And whenever we're trying to do good work that's hard, we will have those moments of despair. Those pieces in our toolbox are incredibly important. Oh gosh, I can't believe I didn't say this, but there's one last thing I should mention to you, and this has perhaps been one of the greatest forces in the last 2 years of my life, which is certainly people. I reach to people, but in the last 2 years, there's something I did, which I did because I learned about it in research, and that's I formed something called a moai in my life. A moai is an ancient Okinawan tradition where people come together, and often at a young age, and they make a commitment to be there for one another, no matter what may come. And this is often a friendship, between like 6 people, 7 people, 8 people, etc. A few years ago, I formed a moai with 2 of my dear friends. They're friends who I would see from time to time, but we didn't see each other often enough. We lived in different places, and we got together one day at a reunion for a fellowship they were part of, and we said, "Gosh, we always talk about getting together, just never seems to happen." We decided to make a commitment in that moment, walking around that lake, at this retreat site that we were at, and we said, "You know what? From here on out, we are going to commit that we're going to be there for each other." And what that's going to mean is that once a month, we're going to spend 2 hours on a weekend video conferencing with one another, so we can see one another and talk about what's really going on in our lives, not just like sort of the pleasantries, the stuff that friends don't talk about often enough: our relationships, our health, our finances, our worries, the future, whatever it is that may be worrying us. And in between, we committed that we would also, if we had moments of doubt or difficult decisions, that we would text one another. And if we needed to get on a quick call to make a decision, we would. That group has been incredibly powerful. They've helped me make really important decisions in the last few years. They've helped me deal with challenges, health challenges, other challenges, all kinds of situations like in my life. And I hope that I've been able to do the same for them. But those have been my sources of hope during dark times, my sources of light, if you will. And I'm just incredibly grateful for them.
I'm Father Charlie Bouchard. I'm kind of an outlier here because I represent the Catholic Health Association. But I know that we at CHA and all of you do have a common interest here because many of your institutions have programs that educate doctors and nurses and other healthcare providers. And my question for you is, how do you think healthcare is going to change as the result of COVID, both for those of us who provide healthcare and for those of us who prepare healthcare providers?
Gosh, that's such an important question, and it's one that's near and dear to my heart because I do think that, well, two things. One, COVID has just affected our profession in this extraordinary ways, the profession of nursing and medicine and healthcare delivery across the board, not always in good ways. The burnout rate among clinicians is extraordinarily high right now. But I think it's also highlighted challenges we've had even pre-pandemic that we have to address. Here's what I hope will change. I hope that number one, we will recognize that the mental health and emotional well-being of our healthcare workers matters, that we should measure it, that we should ensure that we are doing things to strengthen it, whether it's access to mental health care services or building a culture inside the healthcare professions where people can seek help when they can talk about their emotional health and well-being. That culture doesn't exist in many health institutions right now. The second thing that I hope will change is, and this is more technical in nature, but in the manner in which we deliver care. We have used telemedicine and virtual care to a much greater extent in the last couple of years than perhaps at any other point, in the history of healthcare in our country. Some of that has actually been quite good. It's allowed people to access care who otherwise wouldn't have traditionally haven't been able to because they live too far away or they're working 3 jobs and it's hard to always get time to go to the doctor. And so there are elements of virtual care that I believe we can and should make permanent, not as a substitute for in-person care, but as a supplement. And I think it can be a very powerful supplement in that right too. The last thing I'll say, and of the many things that I hope will change in healthcare, is sort of the team-oriented nature of care that we deliver. Medicine has often been, it's a team sport that's often played solo. And I think that leads, in fact, to a lot of, isolation and loneliness in the healthcare professions themselves. In fact, if you look at doctors, their rate of loneliness is higher than that in the general population, even though they're around patients and others all the time. And so I do hope that the notion of working in more integrated teams as opposed to, alone, that will be more of a feature of how we address or how we deliver healthcare in the future. And since you're asked about education as well, I would just say more broadly, both for the care we deliver to patients and also for how we train the next generation of healthcare providers, I hope we pay a much greater attention to mental health. We know more and more about the powerful connection between mental health and physical health, but if they look at how we actually deliver care to patients, it is so skewed in our healthcare system toward a focus on physical health and much less toward mental health care. And that is true of how we train and support our healthcare workers as well. My hope is that mental health will be a much stronger focus for patients and for healthcare providers in the post-pandemic world.
Could you share with us just a few reflections on your own personal leadership journey? You have here in our hall today the leadership of Catholic higher education in our country. And as I was reflecting in the introductory comments, talking about some of the challenges that you faced over your career, from Zika to Ebola to the opioid crisis, now with the pandemic, and your extraordinary work around loneliness and isolation and the importance of mental health and well-being. A few reflections for our colleagues here on leadership.
Oh gosh, it's kind of you to ask, Jack. I feel like I'm a student of leadership and will continue to be, and there's a lot I have to learn. And, each day at least something happens that makes me aware of my imperfections as a leader. But with that, I do feel blessed to have had many opportunities to learn more over the last few years. Been blessed with the opportunity to serve in government and to do some things in the outside of government, and a few things that I've learned that I try to remind myself of, in terms of leadership. One is that I find that in leadership, our culture matters so much more than anything else, than our policies, than our specific programs. That if we can create a culture where people feel that they are seen, valued, respected, and included, um, that goes a long way to unlocking human potential. And I believe that universities in particular, perhaps more so than anyone else, that you are in the business of unlocking human potential. That is one of the great, great purposes that you serve, one of the gifts that you give the rest of us to society overall. Um, the second thing that I think I remind myself often as a leader is just to listen, to listen, to listen. But before I act, that's not to say that analysis paralysis is the is okay either. Sometimes you got to act. You got to act quickly. Um, but often we have a brief moment to listen, to pause, to consider other points of view before we take action. And every time I have done that, I have not regretted it. Often, when I have not done that, I have, in fact, regretted it. So I have to remind myself often to listen. Um, the third, I think, lesson that I've sort of learned repeatedly along the way, often by not doing it, is the power of keeping our anchors close to us. We all need anchors in our life, and very often those are the people who know us for who we really are, who see us clearly, even when we can't see ourselves, even when we get lost in the forest. And we all need those people around us to remind us of what matters, to support us, to listen to us. And one of the mistakes I made, Jack, when I was Surgeon General the first time around, was that I convinced myself that my job was so important, that the opportunity was so rare to do this, that my time was so uncertain and short that I had to put everything into the job. Uh, and I did so at the expense of the relationships in my life. I didn't talk to family as much. I certainly didn't talk to many of my friends as much. Even when I was with people, I was often distracted. I was on my phones and devices. I was checking email. And even when I wasn't doing that, I was thinking about the meeting that I was going to have and strategizing in my head. I suspect this is not unfamiliar to many of you, given just the breadth and sheer responsibility, breadth of your jobs and sheer responsibility you carry on your shoulders. And the fact that you don't work 9 to 5, right? Like you've got, people coming at you with concerns, all around the clock on weekends and evenings. So it can be hard. But I realize in retrospect that was a grave mistake on my part. Not only because it made the job harder for me, but I burned out in a sense, during that job, because I didn't have the most powerful source of support that I needed. I even, will say during that time, one of my key anchors were my spiritual practices. My time spent in prayer and meditation, and I had allowed a lot of that to also slide and to diminish. All the while, telling myself, I'm focusing on the job, and this is a job that's about service. But no matter how noble our day job may be, it doesn't uh, absolve us of the fact of the need for anchors, for supports, for human connection, for the spiritual support we may need in our life, for other supports. Because at the end of the day, we are human, and no job, with however fancy the title may be, can take that reality away. We are human, and it is okay also to admit when we struggle. It's okay to reach out to friends and family for help. It's okay to have moments where we are vulnerable, because we are human. And in fact, our jobs and our fancy titles, if you will, what they do, in fact, give us the opportunity to do is to help shift and change culture. Because every time we do stand up and talk about our challenges, every time we have a moment of being real, of being open, of being vulnerable, by talking about what matters and may be hidden behind in the shadows, so to speak, that's a moment where we tell other people it's okay for you to be real as well. It's okay for you to stand up and to be honest about what you're going through. And when I think about a society full of dominoes that fall in that respect, of people who are recognizing that they can, in fact, stand up and be real, when we have a society of people who believe that, who can be open and vulnerable with one another, support one another, that's when we become stronger as a society. Now, I'll also just tell you, Jack, that we, like everyone else, I'm still trying to figure out what I want to do when I grow up. Or like a lot of people. I know what I'm doing right now. But I also know that God and the universe sometimes have plans for us that are different from the plans we may have for ourselves, and we never know what those plans may be, what opportunities may come, where the road may twist and turn. But one thing I do believe we have the ability to do is to think about who we want to be in these moments. And sorry if you see the images from my son that's joining us here. He's wondering where I've been. You want to say hi, Mom? Wait. So I'm speaking of being real. This is real life. We all have, family is this part of our jobs these days, especially during the pandemic. But I'll tell you, one of the things I do believe we have the power to do is to choose who we are, like in these moments. And this has become more important to me since I, in fact, had children, because I look at the world around us, and my worry is that there's a lot of fear in our world right now, Jack, and that manifests as anger, it manifests as jealousy and rage, it manifests in the division, the deep divisions we see. But I do think a lot of that is born of fear of people, fear where people are worried about the health and well-being of themselves or their family, or they worry about being irrelevant, or they worry about their future, being diminished in some way, or opportunities taken away from them. I do believe also that there's a lot of love in our world, Jack, and we see that in moments of kindness and compassion, in moments where people look to serve one another and be there for one another, not because they're looking for accolades, but because they know it's the right thing to do. And our world is locked in this struggle between love and fear right now. And the responsibility I feel as a parent is to do everything I can to tip the scales away from fear and towards love. And the only way I know to do that, the best way I know to do that, is through the choices we make in each moment about how we show up, about what we reach for, especially in difficult moments. Do we reach for love, or do we reach for fear? And so that's what I've learned, perhaps most importantly, as a leader, is that whatever life may come in life, and I don't know what will come in the future, I know we have a choice, and I hope that we will, in our own ways, we reach for love whenever we can, to try to create the world that our kids deserve, that we all want, a world where we're more deeply connected in purpose, and a world where we support one another.
It's been an honor to have you with us this morning. We're deeply grateful to you for sharing your time, your insights, your perspective, and for your leadership and service to our nation. I want to thank you all very much for your participation, and Vivek, thank you for being a part of this today.
Thank you so much, Jack. Thank you, everyone. It's such an honor to be with you.
I first learned about the Surgeon General's writings in these matter from a friend to a number of us from the Buffalo area, Senator John LaFalce, who had been reading his work and recommended it. And then I thought, all right, who among our folks might know him? And I placed one call to Jack DeGioia, and he said, oh, sure, I'm on another committee with him. So, and then he used his friendship to bring him today, and then he did this work on our behalf. Jeff, as always, thank you. Enjoy your morning.